last spring in this country there was quite a bit of concern about what was called at that time the swine flu virus. We now know it as H1N1. Well, that concern has ramped up again this fall, and we've asked Dr. Deborah McMahon, who's the Allen County Fort Wayne Health Commissioner, to join us today and talk a little bit about what those concerns are and how you can prepare for what could be a severe outbreak this fall, but of course we don't know that right now. And Dr. McMahon, thanks for joining us.
Sure.
It really is a very fluid situation in terms of trying to keep up with what may or may not happen this fall.
Right. Well, viruses are very unpredictable. Right now it could burn out like we saw SARS do in the early 2000s, or it could mutate and become either resistant to antivirals or become more virulent, have a higher mortality rate, or it could remain the same. We don't really know at this point.
As I mentioned last spring, there was quite a bit of concern, and I know we had several deaths here in Indiana, and not to minimize that at all, but from a standpoint here in this nation, we didn't see quite the outbreak that we were first led to think was going to happen. What happened or didn't happen?
Well, I think what initially happened, the first cases were identified in Mexico, and as you can imagine, their surveillance system is not as sophisticated as ours is. And when we started seeing cases then in California and Mexico and Texas and all over then, the CDC really wrapped their arms around this because they knew it had the potential to become a pandemic flu virus. There are 3 requirements for that to happen. It has to be a novel virus, which means nobody would essentially have any immunity to it. Most of these originate in animals like pigs or chickens, and so it has to be able to not only infect humans but actually make them sick. And then finally the 3rd requirement is it has to be able to spread easily from person to person. When they first heard the reports of what was happening in Mexico, it sounded pretty drastic, and so the CDC really tried to put their arms around this while we were determining what is the virulence of this, who are the populations that are most at risk, how easily does this spread person to person. And so I think very appropriately so, for an interim director, I might add too, I think he did a great job at really trying to contain this until we learn more about the virus. Once they had enough data from our surveillance systems here to really be able to see that, well, this is behaving a lot like seasonal flu virus and not the dreaded H5N1 or the 1918 Spanish flu, they were able to relax their recommendations to the point where they weren't closing schools and they weren't making such stern recommendations about isolation and exclusion. But I think very appropriately so, until they had that information, they really, because at that point you don't have a vaccine, you don't know if it's sensitive to antivirals, so the only mechanisms you have to really diminish the transmission is to contain it with social distancing measures. Okay,
fast forward to now, the fall. What's taking place at this point that has health officials like yourself concerned that this virus may reappear in a very strong way?
Well, as you know, on June 11th, the World Health Organization did categorize this as a pandemic, so we are in the midst of a pandemic. We know historically that viruses show a great deal of variability, not only in their lethality, but how they travel around the globe. Typically, though, what you see is that there's at least 2 or 3 passes around the globe, so it starts in, say, the spring, and then it will tend to come back again. The concern is, of course, that something, as we talked earlier, a mutation may occur that it may become more lethal. That's, in fact, what happened with the Spanish flu or the 1918 pandemic. Started in the spring, much like this, not much more severe than what you would see with seasonal flu. But by the time it came back in the fall, it had mutated to the point where, at that point, 50 to 100 million people died worldwide. That's always the concern. That's always what you need to really be monitoring for, which they are doing in the Southern Hemisphere.
And you also have a situation now, I know of great concern. Schools are resuming, both elementary, high school, secondary, and colleges, which mean more people coming together, and especially young people who I believe are one of the age brackets that have the most concern for getting this.
Well, typically we know with seasonal flu virus that 60 to 70% of community outbreaks start in schools. Couple that with the fact that, again, we have a novel virus. We also have seen a fairly strong amount of influenza A, which we consider to be H1N1 at this point, activity in summer camps. And now we're putting kids together in school. They're coming together in the fall. That is a concern. We do want to make sure that we are trying to put education in place, that we're trying to make sure that if when a vaccine becomes available, we're able to provide it to kids to really stem that transmission in the schools.
Let's talk about that a little bit more, because I know this subject has occupied a lot of your time right now, time and energy. What kind of things are the health department doing to prepare for this?
Well, we've had a long history of really productive meetings with our community members preparing for a pandemic, and now that it's here, that's continuing. We've met with people from the schools, we've met with people from healthcare, from business, all trying to make sure that we're getting the message out that you need to be prepared. We want to make sure that we're prepared if we have a vaccine, that we're able to dispense it in a way that makes sense and makes it readily accessible to most people who meet those criteria that for high priority groups. But we also want to make sure that we minimize the disruption to our community if we do see outbreaks before we have the vaccine available. And again, that's education. That's really making sure that businesses have their plans in place, that they have adequate materials, hand sanitizer, tissue, all those kind of things that they have in place should we start seeing a lot of flu activity.
And government as well, because the wheels of government have to keep on turning no matter what.
That's right. That's right. Well, you know, this really is a good opportunity to go back and look and see for just all hazards. Do you have a continuity of operation plan? Do you know what the essential services, whether you're a government agency or you're a barista at a coffee shop, what are the essential services that you need to provide? Do you have the depth in staff and cross-training to be able to provide those essential services, and do you have the supplies you need to do it? Those are really what you need to do.
What kind of advice are you giving to individuals at this point to prepare for the possibility of the return of H1N1?
Well, a few years ago we created a preparedness handout, and we sent it out through the newspapers, and now it's on our website, fighttheflu.org, that you can go there, and it really talks you through all of the different things you need to make sure you have on hand. Other things that you've thought about, child care issue, if the schools would close, what are you going to do? And you want to make sure you have some depth to that as well for backup. I encourage people to look through those things, make sure they have what they need on hand, make sure they've made those arrangements that need to be done. And then really, you know, again, the same things that we talk about all the time. You know, obviously, wash your hands frequently, carry hand sanitizer with you. I really appreciate the local grocery stores having those hand sanitizer wipes for the carts. I think that's a wonderful thing to do year-round, let alone with a pandemic. Cover your cough and all those, you know, respiratory etiquette things that we ask people to do. But now more than ever, we really encourage people, if you are ill, don't go to work, don't send your kids to school, especially if you have a fever. If you have a fever, the fever should be gone without taking any medications to suppress it for 24 hours before you go to work.
And what will be a sign to folks symptom-wise that they don't have the regular flu, they may have this type of flu that we're talking about?
Well, virtually, that's a good question. The Centers for Disease Control and Prevention is doing a lot of surveillance activity for influenza. They do that every year. We're fortunate here in Allen County. We have a Sentinel site where they do a lot of monitoring, and free of charge to the government, I might add. ReadyMed is doing a great job, and other Sentinel sites here in town send that information to the CDC. And I can tell you that we're seeing higher levels of influenza activity than we normally do at this time of year, less than we did in the spring, though, of course. But virtually everything circulating right now that's influenza A is H1N1.
Okay, so something for folks to keep in mind. Dr. McMahon, thanks so much for being with us, and keep us abreast of anything that changes in terms of the situation here, and we'll certainly be willing to pass that information along to the public.
Sure, thank you.